Mississippians are stepping up. There will always be some who disregard the law, but by and large, Mississippians understand the need to protect their family and their neighbors. They're working hard in uncertain times. It's not easy to be isolated. We were created for community, and particularly in Mississippi, we love hanging out with our friends and our families. We know that you are doing something hard, but we also know that you are doing it well. I want to thank each and every one of you for stepping up to do your part to help us get through the coming days and weeks. This is not easy, but we will get through it together. Our focus today is going to be on the public health crisis that is unfolding across our country. But I do want to take a moment and talk about another crisis that is running alongside it. The United States is facing historic unemployment brought on by this deadly disease, and we are feeling that here in our great state. We've already seen a 3,000% increase in unemployment claims in Mississippi. That's never happened before. That is going to get worse before it gets better, just like this virus and the deaths associated with it are going to get worse before it gets better. No system was created to handle that kind of drastic increase overnight. The employees on the line at the call center are working class folks. They're trying, but they're being asked to do 3,000% more work in a very short period of time. We've increased the hours. We've increased the staff. We've increased the ways you can apply. We're still trying to catch up to the massive numbers. That doesn't help if you're trying to get through and can't. I know that, but we are working to make it right. You will get what you are entitled to, no matter when you get through. Your money is based on when you lost your job, not when someone answers the phone. There are some new solutions in the works to deal with this historic increase. It's going to get fixed, and we're going to provide more help than ever before. Mississippians are generous people. Please look out for your neighbors. They may not broadcast it, but many need food or a little cash just to get by until we can get this right. I also want all Mississippians to know that you will not personally be on the hook for payment for COVID-19 treatment in a Mississippi hospital. Major insurers are waiving those requirements. And if you are uninsured, in my conversation with the Vice President and his team today, he assured me that the federal government will cover those that are uninsured. Seek treatment if you need it. You will not be required to pay on this COVID-19. I want to give an update on what the state is doing to prepare as we enter what we believe to be some very dangerous, deadly weeks ahead. The health experts on the President's COVID-19 task force have advised us that the data from the Institute for Health Metrics and Evaluation is what they are most closely tracking. We have been doing that as well for a long time. That information is public and available at healthdata.org. But let me be clear, there is no perfect model. It's like a weather forecast. It's not going to be exactly right. It's designed to be as accurate as possible, giving the data that is available at any point in time. In fact, just in the last 12 to 36 hours, it was revised down drastically. Our plans are based on recent higher projections, but this is the one that the nation's top experts are following. They predict that we are approximately 12 days away from peak resource use, and that would be approximately April the 18th. Just yesterday, their model suggested April the 21st. So as you can tell, lots of changes are happening readily. It could still be sooner or later, but we believe it will be near the last 2 weeks of April. That is why we have held the shelter-in-place order for this most critical period. As Dr. Dobbs has said repeatedly, as Dr. Byers has said, as many of our experts have said, the shelter-in-place order is not a long-term solution. It is a temporary tool. Remember that all of this is aimed at preventing our healthcare system from becoming overloaded at the top of the curve. We are getting closer and closer to that moment by the day. In our state, we have faced more emergencies than most. We know that we must plan for the worst, pray for the best, and expect somewhere in between. We also know that we cannot simply plan for what is projected. We've taken the recent IMHE projections for how many beds we need, and we've increased them by 50%. That is our minimum target for preparedness. You can see that based on those surge plans, we could need at least 3,392 total beds for patients at our peak. We currently have 3,000 available. We may need to increase capacity by at least 400 in coming days, and I plan to tell you what our plans are to ensure that we have those 400 beds, approximately 400 beds available. 250 of those beds are currently ICU beds. We plan to increase our ICU beds by at least 254. We have, we believe, an ICU bed reserve of 356 beds throughout the system, and that is what we are planning for. Now, there are three primary methods of scaling up our healthcare system to prepare for the peak. The first is hospital decompression. For instance, we've ordered all elective procedures to stop. We've instructed everyone to stay away from the hospital unless it is critically necessary. The effects of that are already being felt throughout the system. There are places where healthcare workers are stretched thin and working tirelessly, but there are others where medical professionals are waiting in the wings for this surge. The time is coming. This is why we have been trying to reduce any unnecessary hospital use. We have an ICU reserve of 356 beds in Mississippi. Those are not included in the currently available number. They rely on hospital decompression, and they rely on the work of individual hospitals to surge forward. We are working with them to activate them now. As you saw the other day, we are also working with the Mississippi State Medical Association and other leading healthcare experts to develop a statewide COVID-19 system of care. Dr. Hayes and Dr. Claude Brunson were here on Friday, and they discussed those efforts at length. Here's what it boils down to. We need an acute care for patients who are experiencing severe symptoms. We need to treat them, then we need to transfer them perhaps to a different facility so that the next patient can get the same level of quality care. We need transportation to make that process run smoothly. We will need staff because a bed on its own without the proper staff is useless. And we will need coordination within the system to ensure that everyone is operating from the same playbook. All of that coordination has been happening over the course of the last several weeks. And I hope to have Dr. Hayes and Dr. Brunson here again soon to brief you on the progress. It tracks what those who spend a lot of time managing emergencies call the hub and spoke model. The acute care for people who with severe symptoms comes from our larger hospitals, those with large staffs, sophisticated technology, and ICU capacity. We are working with our smaller rural hospitals to develop contracts where they would be paid by the state to house COVID-19 patients who do not require that same level of treatment. They will serve patients who are through the period of needing acute care or have not yet reached that point. I can tell you that they are eager to get involved. We're also working to stand up alternate care sites. We cannot rely solely on our existing healthcare infrastructure. We are going above and beyond. These will serve a similar need as our smaller hospitals. We are working to identify a site in North Mississippi that could handle approximately 200 additional beds. We are closing in on that right now. We have identified a space in South Mississippi, Camp Shelby, which is a National Guard facility outside of Hattiesburg. As I traveled there the other day, along with Dr. Dobbs and others, our men and women in uniform made it very clear. They are ready, willing, and able to step in, as they always do in times of crisis. They would be prepared to handle 200 beds for patients that fit the criteria for this level of care. I saw for myself that this is a real practical solution for this unprecedented problem. So to recap, we are close to our peak resource use. The best available model says that it is coming in the next few weeks. There will be more Mississippians who die from this virus. It is serious, it is contagious, and it can be fatal. We cannot completely stop it from spreading, and we know, as we've said repeatedly, many in our state have unique risk. You can keep yourself as safe as possible by following CDC guidelines. We can all put our trust in the global scientific community to develop a treatment, and we can do everything in our power to achieve one goal. Mississippians who could survive with the best available care should get that care, even as we hit the top of that curve. That is where other countries and perhaps some other states have experienced the most pain and the most loss. We believe we may need 392 more total beds. We believe we may need 254 more ICU beds. We have identified 200 in South Mississippi, and we are close to securing another 200 in North Mississippi. In addition to that, we are working to activate the reserves of approximately 356 ICU beds throughout the system. What does that mean? It means we can do this. It relies on a heroic effort by our healthcare community. It relies on all of our emergency personnel to step up and do what they are trained to do. We still have to execute when the time comes. It relies heavily on the people of this great state working to flatten the curve in the coming days so that our peak is not as devastatingly high as other areas. It relies on you. It relies on you to stay home and stay socially distant. I know that our healthcare workers and our emergency managers are up to the task, and I know that the people of Mississippi are committed to protecting each other. We can do this. We can get through this together. We will get through this and reopen our state and reopen our economy.